Pour écouter cette session en français, veuillez cliquer en bas de votre écran sur l'onglet Interprétation et sélectionner le drapeau français.
Hello, bonjour.
Barry Saleho.
On behalf of ICLE Africa,
the African Center for Cities,
Our Future Cities,
Red Cross Crescent Climate Center,
and partners, we're excited to welcome all of you
to the Rise Africa 2022 Action Festival.
Rise Africa has been growing since 2020
as a platform for thinkers,
doers,
and enablers,
committed to inspiring action for sustainable cities.
This year's theme is
creativity.
For me, this means blending skills to be able to communicate the climate change complexity in rapidly urbanizing cities.
I think we have such untapped potential in Africa when it comes to creativity. There's so much about Africa that is yet to be told.
There are so many people in the African continent who have a huge skill base and are creative in the way they approach challenges.
Creativity in Africa is about embracing our own. It's about dynamism and it's about embracing our indigenous knowledge.
I think agency is finding ways of giving power back to people, to groups, to young people, especially on a continent where it's a very young population.
I like the approach of bringing everyone together, right? It doesn't necessarily need to be this expert, this high-ranking official.
I think what agency means to me is change from the ground up.
The importance of urgency is the recognition of the past and the recognition that we've lost time.
Urgency is about acting now to build more inclusive, productive, and resilient cities.
There's this need to creatively redesign and unlearn and explore new ways of thinking.
The festival is hosting 33 sessions
with 135 provocateurs
from across Africa and the world.
Every session aims to show new ideas,
showcase ongoing action,
and launch new initiatives, bringing participants together
to chart a new route forward.
We hope that the festival program will inspire you.
At the festival, we encourage you to showcase your business and projects,
build lasting partnerships,
unleash your creative potential,
commit to sustainable action.
Rise Africa is about translating ideas into action. What actions are you going to commit to this festival?
Before the session begins, it is important to note that you're being recorded.
And by participating, you are given the consent to be recorded.
All recordings will be available on the program page after the festival.
Creative expression is vital for creating new futures for our cities.
And so we invite you to enter this session in the spirit of creativity and dreaming.
I don't expect you to clown yourselves and collapse the distance and difference between sharing bread and sharing bed. I know that feeling, so give me a break and stop the fake. They say a hungry man is an angry man, but I say I am not hungry, I am hunger. I am not angry, I am anger. I am not dangerous, I am danger. I am an abominable time bomb, able to blast limestones and thunderbolts because somehow I am torn, tried and tired. So you see, you don't have to hear the sound of my voice before you know that hunger is real, scarcity is not. So please, check the time. It's history time, passion time, meaning time, access time, free flow time, sharing time, bread time, your time, my time, our time. Now, oh, now is urgent time.
Hey everyone, welcome to today's session. My name is Eddie Jemba from the Red Cross Crescent Climate Center, and it's my pleasure to be co-hosting or hosting this particular session. And with me, I have three speakers who will inspire us and enlighten us regarding the heat risk in African cities. Why are we here? Yes, we are here to raise the voice about heat in the African cities, which we think in general it is a forgotten risk. It is, as we will hear from our panelists, there are lots of gaps that we could fill in to make sure that the future of African cities is bright. The future of African cities is free from extreme impacts of extreme heat. Now, as we are talking, it could be that somewhere around the world, somewhere in an African city, it is much hotter compared to where you are. And seasons change. And for those people who are usually in the tropics, I think we are used to a little bit of higher temperatures. And somewhat that is one of the reasons that we never really care about heat. But anyway, what do you know about heat risks in African cities? What do you need to know about heat in African cities? What do you need to do? I think by the end of today's session, we'll be able to have some answers to those questions. Thank you. Thank you. I get some, thank you for that feedback. Let me see if that changes. Well, without further ado, let me invite my panelists to introduce themselves, and then we will start with the first one. Right now, I would like to invite Vincent Pagiwa to introduce himself, and I'll invite Kathleen to paste the bio of Vincent in the chat. Thank you. Vincent, please introduce yourself. Hi, Vincent. I think we cannot hear you.
Hi, Eddie.
Hi, Vincent.
Can you hear me?
Yes, I can hear you very well. But the video is frozen, so probably there is a challenge with the network. And I can as well switch off my video to ensure that everyone can hear you proper.
Hi, Eddie. Can you hear me?
Yes.
Hi, Eddie.
Hi, Vincent. We can hear you well. Well, I will quickly read your bio here. No worries, as you fix your internet.
I seem to have a problem with connectivity here. I can't hear you clearly. I don't know if you can hear me that side.
Yes, we can hear you. But let me invite Joyce to introduce herself. Then we can get back to you after Gigma.
No problem.
Joyce?
Thank you, Eddie. I hope you can hear me well.
Yes, we can.
Yeah. So thank you so much for inviting me to this session today. My name is Joyce Kibutai. I'm a climate scientist. I work with the Kenya Meteorological Department, and I'm also affiliated to the University of Cape Town, the African Climate and Development Initiative Institute. I'm also the alternate focal point for Kenya for IPCC, And I'm quite passionate with, my research is actually on understanding extreme events, particularly looking at how anthropogenic climate change is modifying risks associated with these extreme events. And I'm happy to be here today. Thank you.
Thank you very much, Joyce. And now I'd like to invite Gigma to introduce himself. Hi, Gigma.
Hi, everyone. My name is Kiswan Gigma. I'm a climate scientist like Joyce. I'm based in Ouagadougou, and I'm working with the Red Cross Red Crescent Climate Center. It is my colleague. I do research in climate science and specifically on heat waves. I'm interested in the large scale and local drivers of extreme heat across West Africa, but also on the predictability, how numerical models can be able to better represent and predict heat waves. And I'm more and more, with my recent involvement with the Climate Center, I'm more and more interested into how we turn this knowledge we have on the physical science of extreme heat into action. How do we translate the numerical predictability into early actions that will help relieve the populations from the burden of heat? That is it, over. And I'm really happy to be here this morning. At least it's morning for me.
Thank you very much, Gigma. And I would like to sound a warning ahead of time that it is threatening to rain here where I am. And when it does, usually that takes away power. So in case that happens, I'll have to switch from one gadget to another. So you excuse me ahead of time if that happens. Okay. Thank you very much, Gigma, and we are glad to have you here, just like we're glad to have Joyce. We will maintain this as a conversation among ourselves and to the people out there who are keen to understand about heat risks and what actions can be taken to mitigate the heat-related impacts in our cities. Now, going back to Vincent, hoping that the internet is working better.
Yeah, can you hear me, Eddie?
Yes, I can hear you well.
Yeah, Ace, I'm sorry. I think I have a serious bad connectivity. I have to change the rooms where I am. It's actually, maybe there's a better connectivity now. If you can't hear me or there's a lot of breakage, just let me know.
Sure.
Yeah. Okay. Should I share my slides?
Yes, Vincent, you may introduce yourself and then you start by sharing your slides.
All right. Okay, good afternoon, everyone. And my name is Dr. Vincent Pagiwa. I'm a public health research fellow at the University of Botswana, based at Okavango Research Institute. And my work, actually, I research on tropical disease, of course, and the issues around climate change and health. So my talk today will be based on the cities as well as the impact of heat on the health of human beings. So basically that's that. Nice to meet you all. All right. I'll talk to you, like I said, about cities, how unprepared our cities, and in relation to the health effects as a result of heat. And if I take you a little bit back from last year, the global mean temperature was about 1.09 degrees Celsius, which above the 1850 to 1900 average. This means there was an increase of about 1.9 degrees Celsius. And according to the World Meteorological Organization analysis, it was anticipated that 2021 was the 6th or 7th warmest year on record globally. This means the Earth is warming up as we age. And we have seen also some disasters or extreme temperatures worldwide. For example, in last year, a heat wave in Canada and some adjacent parts of the US push temperatures to nearly 50 degrees Celsius. For example, the Death Valley in California reached 54.4 degrees Celsius. And also not in America, but also in Africa. There were some extreme heat recordings, especially in the North Africa. For example, on the 11th of August, the city of Tunis in Tunisia, it recorded about 50.3 degrees Celsius. And also these heat waves were accompanied by large wildfires, which affected a number of countries in Africa, and Algeria being the mostly affected. And what should we know? Actually, I saw these two reports on my right, or on the right side of the slide, and they've got key messages that we need to know, or what we have to be aware of. The first one is the Greenpeace report, which actually stipulated that Africa will be heavily affected with global warming in the form of heat waves, floods, and droughts in the future. And also researchers, those who are doing that work, expect Africa to be one of the hardest hit regions by climate change, especially that there are fewer resources available to adjust to global warming impact. And also some studies have shown that the continent could warm to an average of 2 to 6 degrees Celsius by the end of this century. So the World Meteorological Organization also has predicted that by 2100, we should expect a temperature rise of 2 degrees Celsius in Africa. So this is a serious concern. And also this increase in Africa's warming is expected to result in more frequent heat waves across the continent, with less rains in the southern and northern Africa, and more precipitation in the central and east Africa. So the second report, which is the state of climate in Africa, also says the same, that Africa continent is heating up faster than other parts of the world, and also adding that by 2030, 118 million extremely poor people will be subject to devastating impacts of drought and intense heat. And also many of the temperatures which are currently being presented or recorded in Africa are actually closer to the limits of human survival or livability. For example, if we take an example of Tunisia, which recorded 50 degrees Celsius, that's a lot, and it's really not safe for the human survivor. And also in Mali, last year, communities has to do with only a little rain of about 3 months, which was from July to September. And also these consequences were very catastrophic, affecting human health, agriculture, and livestock activities. Okay, so now we're turning to the cities, because cities tend to be the most affected areas of our lives than the rural areas. So as the world braces for more intense heat waves fueled by climate change, urban centers across the world are unprepared to face this brutal natural disaster, because normal our activities, they don't show preparedness for these catastrophic effects of heat. Cities can run several degrees hotter than non-urban environments, like I said, and this effect, as we know, is called urban island, which put city dwellers at risk during hotter weather. In the cities, we use asphalt in pavements and also roof shingles, for example, which provide kind of a dark surface that reflects less light and absorbs more heat. In the cities, we find closely packed buildings, streets, there are fewer trees and plants, which also reduces potential shade. And also with this less greenery, the natural cooling effect is also gone. This means there's nothing to cool the environment around the cities. So, and then these citizens who are living in the cities or urban areas, they actually are affected more by this heat island and also the heat that comes with it. And according to the Intergovernmental Panel of Climate Change report of 2014, Many emerging global heat-related risks will be concentrated in urban areas. This means there's a lot of health risks which are coming, more especially in big cities because of these heat issues. And heat waves hit hard on the cities, and particularly because of the infrastructure that both exacerbate and fails to handle extreme heat. Most of our infrastructures, they actually are not designed to handle, and they also can exacerbate the extreme heat. And also noting that over 50% of the population, they reside in dense cities or in dense population, which means that they are likely to be the one affected by heat-related illnesses and deaths. And like you see from that picture, that's some buildings from Gaborone, the city in Botswana, where I come from. Most of those designs are actually from Europe. They buy designs which are actually supposed to be made for hotter areas, and they build them in Africa. Botswana is a semi-desert country, and imagine you put that a black glassy building in such a hot and semi-arid environment. And if you look closely to the pictures, you find that those buildings, mostly the windows are open. That means that there is a serious problem maybe with the cooling systems, and people are affected and they need circulation. So in Africa, a problem of power supply, and you build such buildings and there's not enough power supply, people are going to be affected, and the issues of heat stress goes high, low productivity, and the economy also collapses because people call in sick, people, they don't perform at work because of such buildings. So there have been so many cases. It's something that can be worked on, researched on, but there are so many cases where people are affected because of such buildings, which are built of glass and are black. And why is Africa heat impact neglected? It is neglected for several reasons, but the most pertinent ones is that extreme heat effects are underreported, and then putting people on more danger because we don't record or report some of these events, like I said. And there's also a near complete absence of reported heat waves over the sub-Saharan Africa in the disaster databases. So in the international disaster database, there were only 2 heat waves in sub-Saharan Africa since 1900, which were actually listed. But every year there are warnings, there are heat waves, but we don't record those heat waves and the impact they have on people's health. So they are not recorded, although they're happening. All right. So this lack of reporting actually on deaths associated with heat waves means that there's also little awareness of extreme heat, how extreme heat also can be deadly. So we don't know how heat waves can be deadly. And that's why we don't put better early warning systems or measures to help mitigate those health impacts. And this has actually affected a lot of people in the industry in Africa, in the African cities. For example, if you look at other countries like the city of Ahmedabad in India, they actually came up with a heat implementation plan, which actually helped them to experience fewer deaths and fewer cases, even during the intense heat wave in 2015. So it showed that after the implementation of a heat wave plan, so there were some positive results that came in. So it's something that also we can copy from and have plans in place. There are no early warning systems, or they are not adequate in Africa. No heat action plans, like I said. And also there are also unnecessary premature deaths, which are not even counted. So what we need to do? This heat waves or heat problem is not for the future. Africa is already feeling it, it's a reality, and we see, even though it's not recorded. And on a positive note, nearly all heat-related adverse health outcomes and deaths, they can be preventable. So this means these are disease or conditions that can be prevented if good mechanisms are put in place. First of all, we can have early warning systems and heat action plans that can be beneficial. So cities need to adopt such things. And like we see from that picture, the first one, those are early warning that can be put in place, or they can be placards or adverts that can be put around the cities. People, they know tomorrow is a hot day, what do we need to do? Also, rather than only focusing on lowering the greenhouse gas emission, we can also encourage solutions that can help populations in the cities endure this extreme heat. For example, we can have more systematic records of heat-related deaths and improving coordination across different public sectors that can help identify a population at risk and also how to improve emergency responses. For example, the cities can make a plan to, heat or disasters are something that need inter or multi-organizational efforts. The ministries of health, of environment, researchers, and other NGOs. So these are things that they need to be put in place. And also we need to plant more trees in the cities, because planting more vegetation such as trees, grass, green roofs, and shade, and it cools the city rather than turning cities into an oven. So we need to encourage planting of trees, because when we construct, we cut more trees. So we need to plant more trees. Also, heat waves are killers. During hot days, we need to put measures like, for example, opening up public buildings to provide cooling, cool rooms, and also distributing free waters, informing people about the dangers of heat and early warning that can reduce the danger. So in most countries, we find that they are already doing that. And, sometimes even in Africa, pools, there was someone who was making a joke that since in Zimbabwe, when the Europeans left, the community turned swimming pools that they were given into, they covered them with soil to plant, to do backyard gardening, instead of knowing the purpose of those swimming pools, because they're made to cool during the hot days. So we can, embrace those ideas of having cooling mechanisms rather than covering them up. All right. On a positive note, also, if you look at the picture that is on the right there, that's a new building in Botswana. That's a desert, but there's a very beautiful structure that is coming up there. That building is an innovation hub. So it's really made to be self-sustainable and also using the green technology. So I think this should be the way to go. It shouldn't end there as a donation or something, but it should also be encouraged in all kind of architecture in cities, so that we build buildings that are in line with the weather conditions, that also facilitate cooling and also prevent heat waves and the effect that comes with that. Thank you so much. I'll have questions and comments.
Thank you very much. Thank you very much, Vincent, for the insights that you've shared. And you have one question down in the chat, which says, are there considerations basically on what kind of trees that should be planted which can tolerate the current and future heat waves, as well as water scarcity or stress? Do you have any idea on that? You also mentioned earlier on about 50 degrees experienced in Tunis. Is there an agreed upon temperatures that people can withstand at any given time? And then there's one more: how can we encourage action to be taken by cities to include heat mitigation practices in their policies? Yeah, over to you, Vincent. Vincent, can you hear us?
All right, sorry. I'm talking by myself because I'm flooded by the slide, so I couldn't see that I'm muted. Yes, thank you for the questions. Those are very interesting and I should say also challenging questions and very policy-rich kind of questions. I'll start with the first one, which was talking about, I can't see it now, but which was talking about the trees. Is there any kind of recommendations or recommended that can be used? I would say, like I said before, that the places are different, and policies are different. Africa is unique from other continents as well. We have different unique weathers as well, and that species or trees that I always see they thrive in that area or in a certain area. Trees that thrive in the Central Africa cannot do that in Botswana because it's a semi-desert. So what we need to do is to encourage technology in cloning, in actually encouraging planting and growing trees which are a bit more resistant to climate change. Like that building that I showed you, most of the trees there are not imported. Those are trees which are local. But if you look at the building, they are greener than the other areas around it. So it means that there should be more technology of actually improving the local trees that we have, and we use them instead of importing trees from other countries because they're doing well in another country, they can't do well in certain countries. I don't know if I answered that question well. And the second one was, I can't see the questions, Eddie, so I don't know what's happening.
The second one says, how can we encourage action to be taken by cities to include heat mitigation practices in their policies? How can we encourage? Yes.
Okay, cities to take action. All right. I think this is a policy issue and also highly political. I'll say most of this is to encourage multi-sectoral collaboration where there's a kind of a network and they're working together of experts in the same area. Like I said, it cannot only be the responsibility of cities, or should I say the local government. It also has to be a responsibility of the community at large, different stakeholders, different skills and expertise. So they come together and they can also guide, and also researchers and also empirical evidence on how these mitigations could be put to practice, or the policies actually they can be there but they're not practiced. How can we do that? So it's in a nutshell, it's a multi-sectoral collaborative effort that need to be done to encourage cities to do that.
Thank you very much. And I hope you will come back later also to speak about the relationship. Is there a direct relationship between heat and health in cities, or and to what extent has that been researched? To what extent are these two different institutional or the sectors, the health sector and then maybe the climate sector? To what extent are they coming together? And probably you can also tell us about the initiatives that are going on, if any, to bring these two together. But I will bring you back to say that. Right now, I'd like to take a flight or probably a ride. If it's on a bicycle, I don't know how many days it will take me, but I would like to take a ride from Okavango all the way to East Africa, Nairobi. Joyce Kimtai, please.
Thank you, Eddie. Let me share my screen.
Screen loading.
Screen loading. You're right.
Yes, we can.
Can you see my screen?
I think it's coming to full screen. Yeah, we can see it now perfectly. Thank you. Over to you.
Thank you so much. So just again, my name is Joyce Kimtai. This afternoon in East Africa, Nairobi, I'll be speaking about extreme heat. More specifically, just asking ourselves, how prepared are African cities in coping with risks associated with extreme heat? Also to say that I'm a climate scientist. I work with the Kenya Meteorological Department. I'm also completing my PhD at the University of Cape Town in South Africa. And just to start us off is that we want to understand, so as the climate system is continuing to warm, we're already at 1.09 warmer than pre-industrial. So the planet is already warmed by 1.09 degrees. And this means that hot extremes have become more frequent and more intense across most land regions of the globe. And Africa is not an exception. So Africa is actually even warming faster than the global average. And that says so much about these heat extremes in Africa. And just to give you a few highlights or points from them, some research work I've been going through is that on heat waves is that at the moment, close to 275 million people in the continent suffer at least a day of dangerous heat stress annually. And also to say that magnitude 3 of heat waves have become very common across all seasons in over 12% of African continents. And then there's also projection that there'll be longer, hotter, and more frequent heat waves over Africa. And just to ask ourselves, why do we care then? So why are we talking about this? So reasons for concern is that Africa is experiencing one of the highest rates of urbanization. And we're also seeing very increasing populations as well in these urban cities, as well as in other regions of the globe. But we see this rapid increase in population, especially in the African cities, because of the highest rates of urbanization. And in these urban cities where we see increased population, we also see a lot of vulnerable communities or people living in these cities. And these are elderly people. We have also the homeless in the cities. We have those living with disabilities, the poor, we have the socially isolated, the chronically ill, and even young children. And this group of people are highly vulnerable to extreme heat. So it's really a concern for us on how we need to deal with extreme heat, how we have to continue having conversations around heat, and how we need to adapt to this. And also just to talk about the current state of things in the continent on extreme heat is that heat waves are unrecorded. You also find that heat-related impacts, those are mortalities, hospitalizations, even just hospital visits without hospitalizations are very undocumented, really. And just as Vincent mentioned, is that if you go to the database, disaster database, you don't find any of this information. You can find statistics like 1 or 2 heat wave in a year or in a number of years, which really gives a wrong information about how the continent is experiencing heat. And that limits so much about how we know, what we know about heat waves and how to prepare for heat waves. And also the other thing about the current state of things is that there's very uncoordinated reporting in the continent about heat waves. And there are actually no any early warning systems for heat waves, especially for Met agencies, and I can speak confidently about this as I work with a Met agency in Kenya, is that there's no any early warning systems in place for heat waves. So we've had early warning systems for floods, for droughts and other extreme events or other meteorological events, but we have not had any robust heat wave early warning systems. And so just to say is that with this information is that heat wave is really then a silent killer in the continent, because it means that we don't know much about it, we don't record it, we don't document it, we don't coordinate in reporting it, we don't have any early warning systems, and that it means this is just something that is killing us, and we're not aware that it's actually having this effect on our population. And so what does this mean? It means that then there's no effective preparation for disaster in the continent in terms of heat waves, because if we have no information about this, then we can't prepare effectively for this. And the other one is also it hinders assessment and vulnerability of exposure to heat because of lack of the information on heat, and also planning for climate resilience in the continent on extreme heat will really be a challenge. And so we have to now talk about what are the solutions. What do we think can be the solutions? What's the way forward for this? I just have a few, I've proposed a few suggestions here. Is that one of them would be that we have to enhance collaboration between health experts, disaster researchers, and meteorologists. The other one is also we need to do more research, especially in understanding historical climate data, understanding extreme heat episodes, and trying to relate and understand how are they changing in the warming climate, what do we expect, how do we anticipate for this in future. We also have to talk about improvement of observational networks in the continent. This is very important. We can talk from morning to evening about what we need to do about heat waves, what should be done. But if we don't have the data, if we don't have the underlying science or the understanding of these heat waves, then that conversation doesn't make any sense. So it's very important that we should encourage governments, non-governments as well, institutions to really improve observational networks to understand heat. And this it's not just about meteorological observations, it's also about the data on in hospitals, even other stakeholders that can actually record any heat-related information to have it with them, so that we can actually, so that the first point there on enhancing collaboration can take place. And also, we need to identify unique challenges of heat waves in Africa. So here we are talking about African solutions to address African problems. So we have to talk about what are the challenges here, and how can we do it in the African context. And also, we need to understand direct impacts of heat waves to health, to transport, even to electricity infrastructure. And this helps us to develop procedures for reporting. So it's more of a concerted effort of trying to understand how does heat waves affect different sectors, and then that will help us to work together in reporting and documenting this, and actually waging a way forward for what needs to be done to prepare and to adapt to this. And I just wanted to talk really briefly about this small project that I'm leading, that we're trying now to really understand and see what needs to be done in terms of understanding heat waves in Kenya. So we're looking at 3 Kenyan cities, Nairobi, Mombasa, and Kisumu. And what we are doing is that we are defining thresholds. So I remember Eddie asked a question about that 40 degrees or the 50 degrees in Tunis. And so you're asking about what is tolerable to the population. So you find that we really don't have these values. We don't have these statistics or this information. So these are thresholds. So we don't know at what threshold do we see elevated cases of, say, mortalities or hospitalization or admissions or any other related impacts in any other sector. And so what we are doing in this project is that we are defining thresholds, and we want to understand from that threshold, we want to understand any extreme hot days or extreme events that have occurred in the climatological period or in the historical period. So we're looking at around the past 40 years or so. And we want to establish a relationship or evaluate a relationship between those days or those events with any sort of spikes in deaths or hospitalization or air. So we're looking at, basically we're looking at what's the correlation of these hot days with the hospitalization data. So we want to understand if during these times, there were more deaths reported in hospitals, there were more hospitalization cases reported. So just to understand how actually heat waves are affecting the population. And so today also, as a parting shot, I wish to share a message from the Working Group 2. They just released IPCC report on Working Group 2, that the science is very clear. Any further delay in concerted effort will miss a brief and rapidly closing window to secure a livable future. And we can talk about this in terms of African cities, that we have a very small closing window. We have to secure our cities, and we have to adapt better and have more livable and sustainable cities. Thank you so much.
Asante sana, Joyce. Whoa, I think you leave us with lots of challenges here, but also you paint some nice picture of hope with those case studies that you have begun on. Action, when we are talking about action, yes, there are so many gaps. The evidence of the risk is very clear. There are gaps in data and on research, but then I like the fact that you already are working on defining thresholds for 3 key cities in Kenya. I think you have 2 questions, and then I'll add on a bonus question for you. So let me start with the 2 questions in the chat. One from Megan saying, how do you see COVID-19 and future pandemics hindering planning and disaster response for heat waves? And all our panelists, including Gigma as well, who has not yet shared, plus Vincent, you are free to answer any of these ones. First opportunity goes to you, James. How do you see COVID-19 and future pandemics hindering planning and disaster response for heat waves?
Can I take that later, please?
Oh, yes. Okay. Vincent, would you like to say something about that?
Okay, thank you, Eddie. Personally, I would say when we speak of hindering planning, and I think that will be an issue of I would say lack of resources or expertise to do that. But I don't see COVID-19 actually hindering a lot of things, because we have learned from it actually. Governments are turning up, I mean, they are being enlightened based on their experiences on COVID, and a lot of acceptance in policymakers, I mean, within the policymakers is based on their experiences during the COVID pandemic. So I think probably now they're supportive even on the activities that are going on with heat waves or all other disasters that are climate change based. They are really coming up and supportive of those plans that are coming in. So maybe in the future after COVID-19, we'll see maybe some better improvements in this area.
Thank you very much, Vincent. And I'd like to add something on that. So during at the start of the pandemic, we were already working on the heatwave guide for cities at the Red Cross and Red Crescent Climate Center. And then we realized that some of the actions that were prescribed in the heatwave guide for cities were contradictory to the social distancing and all other COVID-related SOPs. So what we had to do, we had to come together again as a team of experts to start to modify, for example, making sure that any cooling center established is spacious enough and it observes SOPs. And then, of course, strengthening, checking on the neighborhood, things like that. Now, what is my perspective? I think we agreeing with Vincent that there is good improvement and even both on anticipation of future pandemics. but I think we need to adapt as systems to be able to take quick turns to the prevailing condition. So if another pandemic comes up and it requires a different SOPs, I think we need again to be quick to revise our guides in relationship to the needs of the pandemic. Yes, but also investing in research right now. We should be investing in research. You've seen lots of the gaps mentioned by our two previous speakers. Yes, if you are there and you are among the participants and you have something to add, please feel free to join. Right now, I'm reading what Sarah is saying. Sarah says, surely we know the money needs to be spent on planting more trees in order to mitigate heat and getting alternative fuel options into the market that are affordable. I have not understood why gel fuels have not taken off more if costs similar to paraffin, as they are clearly safer. Thank you very much, Sarah, for sharing that. Yes, Joyce, back to you.
Thank you, Eddie. Before you go to the next speaker, I also see a question on the chat about the challenges on the case studies. I think that is directed to me, and I would like to answer that. So there are challenges, there are successes. I can start with the challenge. And just before I also talk about that, is just to say that this project just started, so we are not done. We just 2 months into the project. So we're still at the preliminary stages of the project. And so far, we don't find any major challenges, but what I would say was a challenge is when we were trying to obtain, when we're getting hospitalization data, so you find that there are, for hospitals, for public hospitals, you find that there's a bit of gaps in some data. But because the approach here was that at least in a city like Nairobi, we would look at one private hospital and also look at one private hospital. And for, one public hospital and one private hospital. And for one public hospital, we try as much as possible to get an hospital that is close to an informal settlement. So we're trying to have these diverse demographics of the city. So we look at close to, if you guys have heard, there's one of these big slums called Kibra in Nairobi. So we look at hospital near Kibra and what are the private hospitals. So we found some sort of data gaps, but we were able to get other hospitals that have good data. And for the successes, of course, is to say that it's been going well. We have almost all the data. And being the custodian of the climate data, of course, I have the data myself for meteorology and the climate. So it was just about getting the hospital data, but so far so good. And we will have a paper out of this work as well.
I definitely look forward to reading that data, Joyce. Food for thought, probably to be handled later. To what extent is the health system in African cities provided by the informal sector? And I ask this because I grew up from an informal settlement where I was taken to the hospital when I was very in a critical situation, and that applied to the members of my family and my community. But we used to depend on these small clinics, very small clinics, which I am sure, I will not say I'm sure, but most likely they serve the biggest number of people within informal settlements, and I don't know if they keep the records. Anyway, thinking about African solutions for Africans, we need to think about that more. Allow me to invite my own colleague, Gigma Kiswan Siddhar, to also share some insights about heat and how can we address those ones in the African setting, now getting some humanitarian perspectives. I can see that Gigma's, I think he's just waiting to Max,
I've started the sharing of my screen. Can you see it?
But we see it not in the presentation mode. Yeah,
it's all right. It's all right. It's all right. So thank you. To be frank, I wasn't clear exactly what was the focus of my presentation, so I will delve more into the current research gaps before maybe moving on to the humanitarian perspectives. I think many of the previous speakers have already gone through the basics of heat waves, so I think there is at all no need to go back to that. It is just to mention clearly that heat waves, or let's say extreme heat, the increase of temperature, is one of the most tangible consequences of climate change. You remember that at the beginning, we were not even talking about climate change, but we were most talking about global warming. So this is a clear fact that with climate change, there will be an increase in extreme temperatures in Africa. And Africa has some of the hottest places of the world. And with climate change, these places are going to warm even more than what we already have. So be prepared for that heat. Now, in terms of, I will start here. In terms of what do we do against that extreme heat in the world? You can see here is a map of countries which have developed a heat wave early warning system. Not necessarily heat wave early warning system, but maybe countries where there are some existing tools that allow decision makers or public health officials to engage into heat preparedness activities. And you can clearly see that in Africa, there is almost nothing existing, despite that, as I just said, Africa is one of the hottest places of the world. Surprisingly, there is nearly nothing done to anticipate the consequences, the impact of extreme heat on the populations. And this is a real gap that needs to be filled. Why do we have this gap in action? In heat action, it actually comes first of all from the gap in understanding the impacts that heat waves are having, not just heat wave, but let's say extreme heat. I will explain why I prefer the expression extreme heat than heat waves later. But yeah, it is due to the gap into the understanding of that extreme event on populations, and their livelihoods. And the thing we cannot able to understand it, it is obviously because of the lack of data. Because if the data were there, I would have asked a brilliant scientist like Josh, who just did her presentation, or Vincent, to just quickly analyze this and bring us the results such that just next month we can know everything we want to know from in terms of science of heat waves. But unfortunately, this is not the case. We do not have the data. And in terms of data, there is, of course, we need to start with the meteorological data. In many parts of Africa, there is still a real gap in the collection of weather and climate data. This is quite important. It is often assumed that when it comes to heat wave, we just need to have data on temperatures, but this is just not enough. We need other meteorological data. And one critical variable that we need to be able to cope with extreme heat is the measurement of humidity. It can be relatively cool in terms of temperature, but when it is extremely moist in the place you are living, then you will have, you will see that evapotranspiration is quite limited. You yourself cannot sweat, and as a result, this affects your capacity to cooling your skin. And as a result, you will feel the heat more than what is supposed to be felt just based on the temperature. This is what we call heat perception. So there is a need to increase the data collection on such variables to be able to better understand the heat itself. And of course, there is a need to have more medical records, because this is the primary data source that we use to assess the impacts that extreme heat is having on populations and their livelihoods. And something quite important, and I'm glad Eddie was mentioning is that medical records are very good at depicting the situation in, let's say, developed countries. In the West, it is quite straightforward to kind of have some inferences from the medical records that we receive. In Africa, these conclusions have to be taken with a lot of caution, because actually, as he said, I'm not going to show up at the next medical center just because I feel hot. I will never do that. There is a low, I guess, a low attendance to health facilities in Africa, not just because the network of health centers is quite low in Africa, but also because people don't often see the need to go and visit the doctors for, let's say, minor issues, because for them, the impact that heat is having on them is relatively minor. So it is important to go beyond the physiological analysis to see if we can also try to get the impact data on other aspects. And one of these can, for example, be labor productivity. If I'm facing extreme heat, I can tell myself that I don't mind, I'm still strong, heat is for the week, but I can perceive that in my productivity at work. And as a result, if let's say a well-informed survey is actually conducted, it might let's say reveal some of the hidden impacts that heat have on these populations. Other sectors where data collection could be quite interesting, they're often available but not made public or not made available to the researchers, which we need them actually. Data on power and water. There are a lot of power shortages, a lot of water shortages when there is extreme heat because the demand is so high. And as a result, just analyzing these time series can allow us to also have some knowledge on the impacts that extreme heat is having on population. Another gap is actually the fact that in some countries, let's say there are countries which are doing better than others. And in these countries, the data might be available, but they are not made public. So I think it is important to talk again about the accessibility to data in Africa. And final thing, it is to understand also the vulnerability, to be able to understand that we need more surveys to be able to depict what are the vulnerabilities across the population, and most importantly, what drives the vulnerability of populations to extreme heat. Now, in terms of research, what are the research needs that we need, the research gaps that we need to fill? The very first one, which I'm really happy with, is the very notion of heat wave. Is it relevant for us? I will give you an example. In most cities across Central and even Western Africa, the temperature is not that changing during the hottest period of the year. Let's say for 3 months, we have an average temperature of 35 degrees, and your heat wave days are currently defined by most of the methodology. Your heat wave days will have a temperature of, say, 37 or 38. So there is a 2 or 3 degree difference with the normal temperature that you are getting every day. So is that enough to really have an impact on people who are already, let's say, acclimatized to the extreme heat? This is a question to ask. Should we still keep this notion of heat wave in Africa, or should we move on to other notions which might be more relevant for our context? I'm thinking of maybe the seasonal heat itself. Maybe it is the anomaly of the season with respect to the other seasons, which can lead to having impacts that are quite important on populations. So this is one research gap that needs to be filled. And also beyond the assumptions, it is quite straightforward when we talk about heat waves. We assume that they're having impacts on Africa. They're not recorded, but it doesn't mind. We know that they are there, etc. So we need to go beyond this assumption. Is it true that heat waves do have an impact in Africa? So we do need to do research research across most of the sectors, the socio-economic sectors of Africa: health, labor, power, agriculture, and as well as, most importantly, the social aspects of heat waves, because, as I said, it's not quite straightforward for us to kind of have significant conclusions from the health reports. But when we look at the behavior of people during extreme heat periods, we can then better understand the impact that heat waves are having on them and on their livelihoods. Also, something quite important, and I'm sorry to bring this up today, it is the issue of urban versus rural heat vulnerability. In the West, it is quite straightforward to talk about the urban heat island. Of course, these also already exist in some cities in Africa, and we know that heat waves, as Vincent was saying, is actually quite intense in African cities. However, the largest share of the populations in Africa is still found in the countryside. And are we not kind of leaving these people behind us and just focusing on urban populations who often are better off as compared to the populations, to the rural populations? So it is quite important to make sure that we are targeting the right vulnerable population. Is it not relevant to also consider the rural populations? Why I'm saying this, because in the cities, it is quite cool to find people like Eddie currently sitting now in his room, well sheltered, etc. But in the countryside, most of the activities are outdoor. And is it not relevant to also try to investigate the impacts of extreme heat and see what we can do for these people? So this is a quite important research question to address. And also in terms of future risk, there has been a study looking at the human niche. There is places where temperatures are suitable for the growth of the human community. And it is the case that maybe with the global warming that is taking place in the next couple of decades, maybe some regions of Africa will not be able to host populations, or at least the comfort will not be there. And this can maybe force people out of their homes and maybe push them to go into other areas across the continent. So climate migration, and especially heat migration, is a key issue for research which people need to look at. Now sliding a bit into the humanitarian impacts now of extreme heat, just to give you a couple of reflections around that. Extreme heat is having a deep impact on protection. Protection is one key aspect of humanitarian work. And here, we recently did an analysis, a screening of the ICRC. ICRC is the conflict branch of the Red Cross movement. And they kind of told us that in the Central African Republic, there is a lot of protection issues for detainees. Why? Because extreme heat is felt that much in their cells and they are not actually able to cope with it. So with climate change and with this heat becoming even more intense, what can be done to actually relieve this population also, this special vulnerable population, from the burden of that heat? The same applies also to refugees and internally displaced people. You know that Africa is host to a lot of refugees and IDPs, internally displaced populations. And unfortunately, most of the time, the housing of these populations, which is generally not permanent, is not also good enough to kind of have some cooling strategies in it. So we as the humanitarian sector should work and think more onto the strategies to help cool the places where these people are found to give them better housing that will help them to deal with extreme heat in their daily lives. And as I was saying, heat waves can drive migration. Extreme heat can drive migration, and this combined with other hazards. When you have heat waves combined with droughts, for example, or combined with extreme flooding, for example, this can force people and take them into other places. And when they go into these host places, they can easily get in conflict with the host populations. And of course, this is basically due to the competition for the resources. So this can trigger conflicts, let's say climate-related conflicts, and as a result, there is a need to do more work into that, do more work to understand basically this phenomenon, but also to find the solutions to be able to reduce the burden of these migrations on both the host communities, but also on the populations which have been displaced. I think this is mostly what I wanted to say. However, just one last minute, sorry about that, Heidi. We always think of heat waves and let's say climate change, not only that, most of the time as something negative. However, it might be the case that heat waves and let's say climate change in general is also bringing something positive to us. And then in that case, we need to see the glass full, half full. And why I'm saying this, with extreme heat, I've done some research in West Africa. It has been demonstrated that some extreme heat days are associated with more clear skies, which means that there is an increase in the solar potential associated with extreme heat. So can we not use that extreme that increased solar potential to actually cool our places? That is, we can use that to kind of power our ACs, our fans, etc., etc. So heat waves, of course, come with a lot of burden, but it is always good to keep the good aspects too in mind, because maybe they are also bringing the solutions with them. With this, I thank you for your attention.
Thank you very much. Thank you very much, Gigma. And I realized that towards the end there, you increased the speed, trying to wrestle with time. Would you please take some more, 2-3 minutes to take us through these discussion points?
Yeah, thank you for that. I'm really pleased with that. Actually, these discussions are just a summary of what I was saying. I skipped the first one, the inequalities, because I wanted to show something like there is more heat wave early warnings in the global south, the global north as compared to the global south. What is driving that? When we know that the global south generally is hotter than the global north. This is one. And something quite important too, which I didn't mention, and the slides are quite far back from here. Even in the global south, we can see that there are much more interest in heat waves in South Asia. You see countries like India. Vincent was showing the heat action plan of Aminadab. India, Pakistan, and other countries around that region, they're quite more advanced in terms of extreme heat preparedness than we are in Africa, although we experience similar levels of extreme heat. So what is driving that? Why is it the case that they are more concerned by extreme heat, although we do experience the exact same? So this is a point for discussion. The inequalities in terms of heat wave interest across the globe and across the global south. And the second point, which I think I've elaborated much on, is basically the notion of heat wave. Does it make sense for us Africans to talk about heat waves? The question is quite relevant. As I said, it is easy to take what is happening elsewhere and apply it to us. It might be the case that in a region such as Southern Africa, for example, I'm sure that this notion of heat waves is very important there, because the variability, the day-to-day variability of temperatures and heat is quite important. So we can really have the same type of heat waves as what we have in the global north. But in the equatorial regions, the tropical regions of Africa, this is much more complicated. So does it make sense to still consider that notion, or should we move on to notions that are more of interest to us Africans? And this needs to be determined. I'm not sure what is the most relevant. Is it just one day extreme heat event that will have the impact which we expect it to have, or do we need the heat to last for a month, for 2 months, or do we need the entire season to be significantly hot before we can assess the impact? We can feel the impacts that it is having on populations. So this is an unknown thing which we need to really address. And of course, we do have the whole question on impacts. We do need to do more research on impacts, and there are a number of sectors which are neglected when it comes to extreme heat. It's not just about health. We need to find the impacts of heat waves in Africa in maybe areas which are hidden, because these are not considered of interest in the West, but maybe they are having more interest. They're having, let's say, more importance to us in Africa. And of course, there is the urban versus rural vulnerability, which I've explained, and the features. I think, yeah, that is it from me. Happy to take the questions.
Thank you very much. I can see that Joyce has already a question or a comment. Yes, I see that people have to leave now, but thank you very much for joining. Just to let you know that the Red Cross, International Federation of the Red Cross and Red Crescent movement is preparing a heat action day where we are gathering all our different country specific national societies to improve awareness about the heat risk in the different nations around the world. And I will
You're muted.
Have I been muted all the time? Joyce, over to you.
Okay, I think you mute yourself the last 2 seconds of your talk. I think we got the other.
Please, I wanted you to join. I'm encouraging people to check out that YouTube video about our heat action day, and then please, Joyce, come in with your intervention.
Yeah, so really thank you so much. And I got a bit fascinated by the presentation, some points from Gigma's presentation, especially talking about the notion of heat waves in Africa. So that is very important. And that comes from, so he spoke about what do we call heat waves in Africa? So how do we define heat waves in Africa? And that is what exactly is the problem with speaking about heat waves in Africa, is we don't have definitions for heat waves. So we don't know, is it 5 days of cumulative heat? Is it certain above a certain threshold, a certain degree that we find that it becomes impactful to the society? Is it a certain duration? Are we talking about specific seasons, specific months? So that is exactly what we're talking about as missing all the data or the gaps or the research gaps in understanding heat waves in Africa. And just to say that I think that is one of the points that our project is trying to address. So we are saying that 1,000 steps will start with one single step, and we think our work is among those first steps is to understand at what thresholds or at what temperatures do we really see heat starting to impact on Earth. And so that will become very important even in developing early warning systems to say, hey, we expect that at 35 degrees in Nairobi, cases of hospitalization or mortalities get spiked. And so with that, we try to understand, and we can actually even take that further to policymakers and say, then with this threshold, with this definition of heat waves, then now we can have adaptation measures and strategies in place. And the other point also that I think was a bit fascinating to me, it struck me as well, was on urban versus rural. I think that is very important if we're talking about heat waves, especially in Africa. We know that, so I initially talked about African solutions to address African problems. So we need to look at things in a very African context way, in a way that our populations, we know that most of our populations, as much as we're seeing rapid urbanization, we still have a huge population living in the rural areas. So, and we, as Gigma mentioned, that most of the activities are outdoor. So most of these people spend almost the whole day outdoors, working, being in the farms. So basically all activities are outdoor. And then it means if we don't look at heat waves in these places, it's going to be very detrimental to how we want to tackle and understand and adapt to heat waves, because it actually really, really impacts the society and the livelihoods of these people. And also their adaptive capacity might not be that good, because you find that most of them don't have shelters. And like in urban cities where people can actually run into their rooms or they are work in their offices. And yeah,
Joyce,
thank you very much.
On that point, forget my bias, but on that point, we also, I think, need to think about the who work outdoor, like the police officers. Okay, they pay, but their work dictates that they should stay outdoor. We need to think about the vendors who depend on day-to-day living, who are in the urban, and also they do not have an alternative. So I think, yes, there is need to think about these two, both rural, because my grandmother lives there, and many of her kind, but
So
also
yeah,
the
yeah. So thank you, Eddie. So yeah, sorry, I think I interrupted your talk there, but I was when I say this is it's just throwing a word of caution here that we just can't use solutions that work anywhere else in our region, because maybe in the global north, you find that most of the population is in the cities. Of course, I understand that we still have very vulnerable people in the cities in Africa. And at the same time, we are not saying that we're not looking at heat waves in urban cities in Africa. I'm just saying that we have to be cautious about how we address heat waves and how we push the conversation around heat waves, that we shouldn't, it's very important. And I'm also looking at a compounding case of, this is, I think this is just a proposal that I wrote somewhere and I've not been funded, but I think I'll get funding someday. I was trying to understand how drought really compound with heat waves in rural areas, especially for regions in the arid and semi-arid regions of Africa, where we find that there are pastoral communities where we depend. So, so you find that as much as most of the activities is outside, the drought also affects, which compound with heat can be really very detrimental to their livelihoods. Yeah.
Absolutely. Thank you very much. Two wonderful scientists there challenging our minds to invest more in understanding the heat risks in both urban and the rural context, in both from the physiological point of view and from the climate science perspective as well. And yes, before I call on Vincent to also share what actions have been done, I see we are left with about 7 minutes, so we have to divide those ones amongst ourselves, getting some final thoughts from Joyce, Gigma, and Vincent, as well as telling you what is it that is going on within the Red Cross, Red Crescent movement. Now, talking about what's going on, allow me to show you what are we planning for June this coming month. Yes, we within our own we in the Red Cross Red Crescent movement, we are planning, I hope, yes, a heat action day where we are mobilizing all our national societies, both within the global south and in the global north, and I don't know, is there a global west or east? But we are mobilizing our national societies to come together and do a flash mob as a way of raising awareness for heat and heat waves. So this is one initiative that is going on, and we have also prepared some useful resources like the how to prepare for a heat wave, a heat toolkit, city heat wave guide for Red Cross and Red Crescent branches, and the urban action heat. We are trying to do something, but this one single day is going to be that one where we get people to be inspired to start to think about heat as a risk and even take action. That's what we are doing. What is happening elsewhere? Okay, in 2 minutes, Vincent, can you please tell us about chance and how it is also advancing action on heat as final thoughts?
All right, thank you, Eddie. And yeah, I want to say in conclusion also from the discussion of what was discussed here, I can say there's going forward, there's need for research. I realized that there's a gap in research so that we may understand the relationship between heat and health. That's where we need to start from. It's a take-home message. So we really don't know what's the link between heat and health. Heat and health. So if we do more research, then we'll have answers. And also, what we are doing at the moment, we are also, I would say, a group of researchers who have also come up with an organization, or should I say, a network. It's called the Climate Health African Network for Collaboration and Engagement. And the objective of this network is to bring together stakeholders in heat and health. And we have actually seen a significant improvement in what we do. We've been having some bi-monthly meetings, and also now we are planning to gather all the policymakers in Africa in Pretoria in June. So it will be an on-site, it's a hybrid meeting actually, and it will also be virtual, and also those will be coming there. And the objective is to connect researchers and policymakers to come up with evidence-based solutions that can help governments mitigate or come up with adaptive plans. So we are also going to have another on-site meeting in Botswana in 2023. We're already planning for that, and we are calling all stakeholders to join us. We have got some small funding from the Horizon 2020 project through the MBEL project, so which is helping us establish this network. So you are free to attend. You are free to come to Pretoria, or also attend the virtual sessions of the meeting. We can share the details, and Eddie can share with you. Yeah, basically that's that. We are advancing a lot, and we are seeing WHO also coming on board as part of our meeting. Actually, WHO has also funded a day or so to train, kind of the training of trainers on these issues of heat and health. So that's basically what I can say for now. I think collaboration will also help us if we can keep in touch, and also email me, and I think Edu will share with the email, or can I say it there?
Yes, please, Vincent, share the email there.
Yes.
In case people want to join.
That's my email. We can collaborate and keep in touch if you're interested in issues around climate health. Thank you so much.
Thank you very much, Vincent, and thank you for sharing that initiative of CHANCE Network, Climate Health Africa Network for Collaboration and Engagement. There you go. Joyce, your final thoughts, and yes, reminding everyone, please fill in the form from RISE about feedback for RISE Africa 2022. Yes. Joyce, final thoughts.
Yeah, so thank you, Eddie. Really, thank you so much for this opportunity. So for me, as a parting shot, is that especially from a research point of view, is that it's really important that we work, all of us work closely, the different actors, we work closely in trying to advance the debate on extreme heat. So this requires collaborative effort. It can be done only by scientists or humanitarian agencies or disaster management agencies. So this is something that has to be fully concerted. And also to say that it's also important that we look at solutions that will solve problems for Africa as we advance this conversation and taking it forward. Thank you.
Thank you very much, Joyce, and thank you for joining us today and sharing your insights. Thank you, Vincent, for joining us and sharing your insights. And yes, we hope that the future African cities will be free of impact from extreme events. And to do that, we need to adopt some policies right now, the policies that help us to invest in research, to strengthen our disaster risk management, to strengthen long-term resilience. I like one of the things that Vincent said earlier on, which I tweaked a little bit to say, green the grey. I think we need to green the grey in African cities so as to reduce the impacts on our cities. With that, once again, don't forget to join other sessions today. The link has been provided down there, and also you can join the daily debrief. And today's being the last session, I think it would be nice for you to go to join us in the day's debrief to hear what transpired elsewhere in other parallel sessions, but also a general summary or some key takeaways from the day. Thank you very much. Greetings from Kampala, greetings from the humanitarian agencies, greetings from the Red Cross Climate Center. We love you and we look forward to having you, even to interacting with you offline or online. Bye-bye.